A lot of people, especially in the general surgical department, we feel very much at home here. There's a huge family atmosphere on top of great, excellent training. That's why we chose to come here.
It's a 5-year residency program. We do not require research of anybody, but if you want to do that, we certainly have those opportunities. Because University Hospital, Children and Women's, all of South Alabama has grown so much in the last 5 years, we're trying to expand our residency program to 6 categorical residents a year, which will not take away from cases, but certainly help with the workload. I think we do a really good job really focusing on our individual residents, not just as surgeons, but as people.
When I first interviewed here, I realized and witnessed a lot of the chief residents kind of joking and interacting and kind of ragging with the attending physicians, which is not done at a lot of places. And so that feeling that you can kind of let your guard down a little bit and learn from your mentors, but also, become friends with your mentors was really important for me. And I think that's really important for a lot of the other residents that have chosen to come here.
We value each other's opinions, we value each other's work, and we're able to kind of really form, I think, a close bond through that. And you're able to make it through a very difficult residency because of that.
You can become fully competent and become an excellent surgeon at USA. And part of that is the support of the attendings and your faculty, but also the lack of fellows.
Most academic surgery programs are full of operative fellowships. You name the organ, there's usually a fellowship for that organ. We have 0 operative fellowships. We have a trauma critical care fellowship, and that is it. So even though we have an incredible complexity of cases and acuity of disease, all of those cases, 100% of them are taken care of by general surgery residents. None of those cases are taken by fellows.
It is heavily resident driven, both in the perioperative period and in the operating room as well. As the PGY 4 and 5, you're making the decisions that affect care and that affect a patient's outcome.
You can do 5 years at our program, you can come straight out, you can be a very, very good general surgeon that's competent immediately, or you can also be competitive for the top fellowships in the country. For some of them, they want to be the next great academic surgical oncologist, or they want to be the next great academic trauma critical care physician. Success for us is getting every resident, helping them identify their goals, tailoring their experience, and then meet those goals, and then really, I would say, even exceeding those goals.
The benefit of being an academic institution is that all of our attendings and our faculty are still plugged into the academic world and to leading cutting-edge technology and the most recent clinical trials. I think that environment of education and passion to advance forward is great, is needed, and is present here.